next on our schedule is called Revolutionary Alliances Advancing Stroke Risk Monitoring with AI and Wearable Technologies. OneCareAI pioneers non-invasive stroke risk monitoring using wearable devices. Their AI-driven solution, backed by a successful European project, assesses stroke risk thoroughly by analyzing electrophysical markers, lifestyle data, and molecular evidence. Their collaboration spans hospital, telecardiology services, wearable manufacturers, and insurance companies, making significant strides in stroke prevention. Next, we're going to be joined here by my side by Davide Cirillo from OneCareAI, Daniele Lezzi from the Barcelona Supercomputing Center, and Jara Cárcel from São Paulo. So the stage is yours.
Thank you.
Good morning. So the focus of our alliance is stroke. Stroke is a disease characterized by a neurological deficit caused by a sudden and focal interaction of cerebral blood flow. And if we speak about the consequences of this disease, we know that this is the second leading cause of death worldwide, and it is the first leading cause of disability. The cost of this disease is remarkable because of these numbers. We have that the cost is expected to increase by 44%, and by year 2040, it is expected to be higher than 27 billion euros. So our problem is that this large-scale stroke risk assessment is limited by the absence of effective tools for monitoring the general population and following up at-risk individuals. This is because we do not have a precise stratification of the population, we lack of integrated physiological and important genomic data, and the life potential saving AI tools require big data. And this is where OneCareAI, as things move a bit, gives us a solution.
Yes, with the OneCareAI, we are a spin-off of the Barcelona Supercomputing Center. We are developing solutions based on artificial intelligence and the HPC tools, in particular on stroke risk assessment. So our solution to the problem presented by Jara from São Paulo, as I said, we are aiming at improving their stratification, the risk stratification, so providing a final stratification of the general population through the development of AI models that integrates not just physiological data as electrocardiograms, but also clinical information and above all multi-omics data that they are providing us. And also we are connecting with, we are reaching this general population through the use or the adoption of not invasive devices as smartwatches or wearable devices in general, in order to derive not invasive surrogate markers. And we are from Barcelona Supercomputing Center, so we are, our focus is to apply HPC techniques for fast and efficient monitoring of this stroke risk. So our actual prototype that we are implementing now, we are extending, is based on artificial intelligence model that we trained using large databases on the Mare Nostrum supercomputer at BSc, and these models are offered as a service, and they're available for prediction through the connection with the wearable devices, and the results of this risk assessment, of course, are provided to clinicians, to the doctors, to assess the stroke risk. We come from a very successful European project, both at proposal time, where we were first ranked, but also now we ended in March with the review, and we've been selected as a best-in-class project. So now we are starting this journey of our spin-off from the Sprint in collaboration with the Barcelona Supercomputing Center.
Okay, and currently our TRL is 4, and we tested the capabilities of our solution in a pilot study that we organized within the European project AI Sprint in collaboration with a stroke patient organization called Frenolictus, is the biggest in Spain. A very successful medical device company called Nubo, and also experts in the 12 de Octubre hospital in Madrid. So the pilot study was very interesting. We basically collected more than 9,000 hours of continuous electrocardiograms from stroke survivors and healthy individuals. And in this context, we could assess the integration of the AI with the HPC. We also implemented developed a mobile app for displaying the predictions and also assessing the privacy preservation mechanism that in all this is, of course, fundamental. And the next step is going to be this summer, a study, this time in a clinical setting, in the biggest hospital in Milan, Italy, the Niguarda Hospital. So, of course, we want to enhance our TRL, and in order to do that, we need funding. And so we are applying to a lot of funding opportunities. We are supported by the X4HPC network, and also we are currently involved in the pre-acceleration programs from Barcelona Activa and the Collider. And one example of the impact of our solution is actually the collaboration with the San Pau Hospital, and in particular to go beyond the electrophysiological information and the clinical information, which can, of course, provide this main source of risk factors for stroke, but trying to integrate also the molecular biomarkers. I'm talking about genomics, proteomics, and so here is basically what we are developing together, the solution that we are developing together with our collaborators at the San Pau Research Institute. And our team is composed of leading members that are Daniele and myself, as well as technical members, which are research engineers, experts in high-performance computing, biomedical engineering, and so on. And also we are supported by key opinion leaders and experts in the context of the Barcelona Supercomputing Center, but also in all the different collaborators and institutions that are involved in all these activities. You can check out our webpage, and also we have a booth outside, so